If you snore at night, or you wake up gasping for air, or your wife has been nudging you all night because you stopped breathing, I need you to stop whatever you're doing right now. Because what I'm about to tell you is something that most urologists and most sleep specialists have never put together in the same conversation. Men over 60. Here is the silent connection that could be quietly destroying your prostate health every single night. Sleep apnea and prostate cancer. Two separate conditions, two different specialists. But science is now showing us they may be operating as a team inside your body. Today, I'm going to reveal 7 early warning signs that your sleep apnea may already be fueling dangerous changes in your prostate, and I'll give you simple, overnight fixes you can start using tonight. But I need you to stay till the very end, because sign number 4 and sign number 6 are the ones most men completely dismiss as just getting older. And that mistake could cost them everything. Let's get into it. I'm Dr. Ethan Whitmore. I've spent over 2 decades working with senior men on issues that sit right at the intersection of urology and sleep health, 2 fields that are almost never talked about together. And in all my years helping patients, men just like you, there is one pattern I keep seeing over and over again. Men come to me for a prostate problem, and when I dig into their sleep history, it's a disaster. Undiagnosed or untreated sleep apnea, every single time. Now here's what you need to understand about this connection, in simple terms. Sleep apnea is not just about snoring. It is a condition where your airway collapses during sleep, cutting off oxygen to your entire body, including your prostate, dozens, sometimes hundreds of times per night. And here is the alarming part. A large population-based study found that men with obstructive sleep apnea had more than double the rate of prostate problems compared to men without it. Research published in Sleep and Breathing and cited across major urology journals shows that chronic oxygen deprivation triggers inflammation pathways that may directly affect prostate tissue. And yet, most doctors still treat these as completely separate problems. Today, we change that. Let me walk you through exactly what is happening inside your body while you sleep, if you have untreated sleep apnea. Every time your airway collapses at night, your blood oxygen level drops. This is called intermittent hypoxia. Imagine your body holding its breath, briefly, 30, 40, sometimes 60 times per hour. Imagine you are trying to water a garden, but someone keeps turning the water off for 30 seconds, then on, then off again, all night long. That is what your prostate tissue is experiencing. When oxygen drops, your body panics. It releases inflammatory cytokines, chemical alarm signals, that flood your bloodstream. Research published in PLOS One confirms that chronic intermittent hypoxia in sleep apnea induces systemic inflammatory processes that can cause tissue damage, including in the prostate gland. Chronic inflammation creates what researchers call a pro-tumorigenic environment. In plain English, it makes conditions more favorable for abnormal cell growth. A study from a nationwide population sample published in the journal Sleep found that sleep apnea was associated with significantly elevated cancer risk across multiple organ systems, with urological cancers showing some of the strongest signals. And here's what's particularly alarming about prostate cancer specifically. Research published in Nature's Hypertension Research Journal in 2025 described a vicious cycle, where sleep apnea disrupts your body's hormone regulation, causes nocturnal polyuria, and puts constant stress on your lower urinary tract. It's a spiral, and most men have no idea it's happening. Here is the key mechanism you need to understand. Sleep apnea causes oxygen drops. Your body releases stress hormones and atrial natriuretic peptide. Your kidneys make more urine at night. You wake up to urinate. Your bladder and prostate are under constant pressure. Inflammatory signals accumulate over months and years. This is why the warning signs I'm about to show you are so important, because your body is already trying to warn you. You just need to know the language. All right, let's go through the 7 early warning signs that your sleep apnea may be fueling prostate problems right now. Sign number 1, Nocturia, waking up to urinate 3 or more times per night. How many times did you get up last night to use the bathroom? Once? Twice? 3 or more? Most men in my practice say this is just normal for their age. It is not normal. It is a red flag. Research published in the Journal of Sleep Medicine confirms it. Hypoxia, caused by sleep apnea, directly increases nighttime urination. Here's the mechanism. When your breathing stops, oxygen drops. Your heart responds by releasing a hormone called atrial natriuretic peptide. That hormone signals your kidneys to produce more urine at night, while you're trying to sleep. Nocturia 3 or more times per night is also one of the earliest signs of a prostate under stress. And when your prostate is under stress from both poor oxygen delivery and inflammation, you are accelerating damage. Patients who ignored this and came back to me 2 years later, they had already progressed significantly. But nocturia is just the beginning. Wait until you hear sign number 2. Sign number 2. Loud, chronic snoring with gasping or choking episodes. Does your partner sleep in another room because of your snoring? Have you ever woken yourself up gasping? Has anyone ever said you stopped breathing in your sleep? These are not just annoyances. They are clinical alarm bells. Loud snoring with episodes of gasping means your airway is collapsing, and your body is living in a constant stress response. Every gasp is your body's emergency alarm. Imagine hitting a car alarm button 40 times an hour, every hour, all night. That is the level of physiological stress your body, including your prostate, is under. If this is you, or someone you love, this is the most direct, classic sign of moderate to severe obstructive sleep apnea. And untreated moderate to severe sleep apnea, according to the research, carries the highest inflammatory load on downstream organs, including the prostate. Now, sign number 3 is one that shocks my patients every single time I bring it up. Sign number 3. Extreme morning fatigue, feeling exhausted after 8 hours of sleep. You went to bed at 10 p.m. You woke up at 6 a.m., 8 hours, and you feel absolutely exhausted. Like you didn't sleep at all. Your joints ache, your mind is foggy. You could fall back asleep immediately. This is not laziness. This is what happens when your brain is pulled out of deep, restorative sleep dozens of times per hour by microarousals from apnea events. You never reach the sleep stage where your body repairs tissue, regulates hormones, and resets inflammation markers. Your prostate, like every organ in your body, depends on those overnight repair cycles. Without them, the inflammatory damage accumulates. A 2022 study in the journal Cancers found that sleep disturbances in men are vastly underappreciated in the context of prostate health. Over 36% of prostate cancer survivors were found to be at high risk for undiagnosed sleep apnea. Think about that number. More than 1 in 3. And this next one, sign number 4, is the sneaky one. The one nobody connects to their prostate. Sign number 4. Weak or interrupted urine stream, difficulty starting or stopping. When you go to urinate, does it take time to get started? Is your stream weak? Does it stop and start? Do you feel like you never fully emptied your bladder? Men almost universally assume this is just the prostate getting bigger with age. Benign prostatic hyperplasia, or BPH. And that may be true. But here is what most urologists don't tell you. A population-based study found that men with sleep apnea had 2.54 times higher odds of developing prostate hypertrophy compared to men without sleep apnea. The chronic hypoxia and inflammation from sleep apnea appears to accelerate prostate enlargement. If you are treating your BPH symptoms but ignoring your sleep apnea, you may be fighting a losing battle. You are treating the fire while someone keeps pouring gasoline. In my experience, men who addressed their sleep apnea first often saw their urinary symptoms dramatically improve within weeks. We're halfway through the list. Sign number 5 is one you feel during the day, not at night. Sign number 5. Erectile dysfunction, especially when combined with sleep problems. This is the sign that men are most reluctant to talk about. But I need you to hear this, because the connection is rock solid in the scientific literature. Sleep apnea causes oxygen drops during sleep. Erections require good blood flow and healthy nitric oxide production, both of which are compromised by chronic hypoxia. A systematic review confirmed that men with obstructive sleep apnea had nearly 3 times the odds of erectile dysfunction compared to men without it. And here's the prostate angle. Sexual dysfunction and prostate cancer share overlapping inflammatory pathways. When one is disrupted, the other often follows. If you are experiencing both ED and urinary symptoms, and you are a snorer, this trio of symptoms together should be evaluated immediately. Do not just accept this as aging. This is a clinical picture with a root cause that can be addressed. Now, sign number 6. This is the one I mentioned at the start, the one most men brush off completely. Sign number 6. Elevated PSA levels with no clear explanation. Your PSA, prostate-specific antigen, came back a little elevated. Your doctor says to watch and wait. Maybe it went up slightly from last year. You haven't been given a clear reason why. Chronic systemic inflammation, exactly the type produced by untreated sleep apnea, can cause PSA elevation independently of any direct prostate pathology. This means your PSA could be rising not because of cancer, but because your body is inflamed from years of oxygen deprivation at night. But here is the danger. When you don't look at the sleep piece, the inflammation continues, and eventually that inflamed prostate environment becomes more hospitable to cancer cell development. If your PSA has been creeping up and your urologist has not asked about your sleep quality, ask them. Demand a sleep evaluation as part of your prostate workup. These two things must be evaluated together. And finally, sign number 7. This one connects everything we've talked about today. Sign number 7. Waking up unrested with pelvic pressure or discomfort. Do you wake up in the morning feeling like your lower abdomen or pelvic area is under pressure? A vague discomfort or heaviness? Maybe a feeling that you need to urinate even right after waking up? This is what happens when your prostate and lower urinary tract have been under constant stress all night. Sleep apnea triggers what researchers now call a vicious cycle. BPH, sleep apnea, and your body's circadian rhythm disruption all feeding into each other. Your body's antidiuretic hormone is suppressed. Your kidneys are overactive at night. Your prostate is inflamed. And by morning, your whole lower urinary system is exhausted. Pelvic discomfort that is worse in the morning and improves through the day is a classic sign of prostate stress from nighttime conditions, not daytime activities. This is your body telling you that what is happening while you sleep matters more than what happens while you're awake. Now here is the good news, and I mean genuinely good news. This connection between sleep apnea and prostate health is not a death sentence. It is an opportunity. Because unlike genetics, you can do something about your sleep, starting tonight. Here are my 7 evidence-backed overnight fixes. Some of these you can start in the next hour. Fix number 1. Elevate your head 30 to 45 degrees. Use a wedge pillow or raise the head of your bed. This simple positional change reduces airway collapse during sleep, decreases apnea events, and can reduce nighttime urination within just a few nights. Many of my patients saw improvement in their nocturia within the first week. Fix number 2. Sleep on your side, not your back. Sleeping on your back is the worst position for sleep apnea. Gravity pulls the tongue and soft tissue backward, collapsing your airway. Side sleeping can reduce apnea events by 50% or more in positional sleep apnea. Tonight, try taping a tennis ball to the back of your sleep shirt. Old trick, still works. Fix number 3. Eliminate alcohol within 4 hours of sleep. Alcohol relaxes your throat muscles, the exact muscles that are supposed to keep your airway open. Even 1 or 2 drinks close to bedtime can worsen sleep apnea significantly. For men over 60 who also have prostate issues, this is a high-leverage change you can make immediately. Fix number 4. Hydrate earlier and cut off fluids 2 hours before bed. Most men with nocturia are actually dehydrated during the day and then drink too much in the evening. Flip the pattern. Drink the bulk of your fluids before 6 p.m. This alone can reduce nighttime bathroom trips by 1 to 2 times in the first week. Fix number 5. Add anti-inflammatory foods to your diet. Remember, the core mechanism here is inflammation. Omega-3 fatty acids, turmeric, green tea, tomatoes with lycopene. These are all foods with direct anti-inflammatory effects that have been studied in the context of prostate health. Start with 1 addition per day. Not a complete diet overhaul, just 1 anti-inflammatory addition. Fix number 6. Targeted pelvic floor exercises, Kegels for men. Men rarely hear about this. Kegel exercises strengthen the muscles of the pelvic floor, which directly supports bladder and prostate function. Studies show men who do daily pelvic floor exercises see measurable improvement in urinary control and frequency within 8 to 12 weeks. Start with 10 reps, 3 times per day. Clench, hold for 5 seconds, release. Fix number 7. Get a sleep study, and this one is non-negotiable. Every other fix on this list is supporting action. This is the main event. If you have any of the 7 signs I showed you today, you need a formal sleep evaluation. Ask your doctor for a sleep study, or look into a home sleep apnea test. If you are diagnosed, CPAP therapy has been shown in multiple studies to reduce nocturia, improve erectile function, reduce systemic inflammation, and bring blood pressure down, sometimes within weeks. And if you want to go deeper on any of these fixes, every single topic I cover in this channel has more detail coming. Subscribe so you do not miss it. Because next week, I am covering exactly which foods have been clinically shown to reduce prostate inflammation. And some of them will genuinely surprise you. Let me bring this home. Today you learned something that most doctors haven't connected for you. Your sleep and your prostate are not separate systems. They are deeply, biochemically linked. And what happens in your bedroom at night is directly shaping your prostate health every single morning. The 7 warning signs. 1. Waking up 3 or more times to urinate. 2. Loud snoring with gasping. 3. Extreme fatigue after a full night of sleep. 4. Weak or interrupted urine stream. 5. Erectile dysfunction combined with sleep problems. 6. Unexplained elevated PSA. 7. Morning pelvic pressure or discomfort. If 2 or 3 of these hit home for you, do not wait. Do not dismiss this as aging. Talk to your doctor this week. Ask specifically about a sleep study alongside your prostate workup. That one conversation could change everything. The science is clear. The connection is real. And now, you know. If this video opened your eyes, hit the like button right now. It genuinely helps this information reach more men who need it. Subscribe and hit the bell so you don't miss what's coming next. And drop a comment below. Tell me which of these 7 signs surprised you the most. I read every single one. Share this with a man over 60 that you care about. A father, a brother, a friend. Most men will never hear this from their doctor, but they can hear it from you. I'm Dr. Ethan Whitmore. Take care of your sleep, and you will be taking care of your prostate. Until next time.